Thank you. Chairman Burton, members of the committee, good morning, and thank you for the opportunity to talk with you today about my nomination. I am honored to have been nominated by Governor McMaster to continue serving as the director of the South Carolina Department of Public Health. I would also like to just take a minute to thank all the many folks who are here to support me. I won't name them all, but their support means a great deal to me, and one of the reasons I love this job is the people I get to work with, some of whom are behind me today. So to all of you, thank you. I would also like to thank the members of the committee who graciously gave me their time to meet with me before this hearing. I greatly appreciate the opportunity to talk with you one-on-one. For those who did not meet with me, I ask that you approach this hearing with an open mind and consider the facts I will now lay out for the committee about who I am and how I lead. On February 2nd, 2021, this committee unanimously gave me a favorable report to serve as the director of the South Carolina Department of Health and Environmental Control, the predecessor agency to DPH. 2 days later, I was confirmed by a vote of 40-1 by the full Senate, and I assumed my duties as director on February 4th, 2021. I would like to take some time to review what we have accomplished since I was confirmed a little over 4 years ago, and what I envision DPH accomplishing moving forward to help South Carolina become the healthiest state in the nation, which is the goal I have set for our agency. First, however, it's crucial that I address some outrageously false allegations that have been made against me. No doubt many of you and your constituents have heard these allegations or have been given material by the individuals and groups who are spreading this misinformation. Enemy of medical freedom, health czar, not a real doctor, evil. These are just a few examples of what has been said about me, and nothing could be further from the truth. Let me first address medical freedom, which I know is very important to many of you and to me. I strongly support medical freedom and the sanctity and value of the physician-patient relationship. I am a board-certified medical doctor licensed in South Carolina. As a physician, I honorably served our country for over 30 years in the United States Navy, retiring as a naval officer. Since then, I have served the people of South Carolina for the past 4 years. Over the course of those 3 decades, I have treated well over 10,000 patients. I know firsthand the importance of the physician-patient relationship and oppose any attempts to infringe upon it. Far from being a health czar, I have limited authority, essentially the same authority this position and its predecessors have had since 1908. In addition, at DHAC, I reported to the DHAC board, and now, as director of a cabinet agency, I report to the governor, who has the authority to remove me at any time. For example, I believe that decisions about treatment for COVID or any other condition should be made between the patient and their provider after the patient has given informed consent. I have never supported efforts to prevent physicians from prescribing ivermectin, hydroxychloroquine, or any other medication or treatment. Furthermore, as director of DPH, I have never allowed and never would allow any action by the agency to interfere with the physician-patient relationship. That is not the role of our agency, nor should it be. Another completely false allegation I have seen are signs that say you should, quote, stop simmer, unquote, or, quote, stop repeat of 2020 COVID shutdowns, unquote, which is kind of silly because I wasn't even here in 2020. By the time I started in 2021, the state was open at the governor's leading. I had no part in any decisions to close businesses, schools, or anything else. Indeed, I do not believe shutdowns like those used during the pandemic are effective, and I would not have recommended them had I been here. That's the kind of baseless misinformation you're getting. I would also note that in a January 2022 press conference with our governor about COVID and the increase in cases at that time, I said, quote, there is absolutely no reason to close schools, end quote. Adding, quote, there is a better outcome from our students from an educational and socialization standpoint when they are in school, end quote. In fact, I have never told a school to close due to COVID. School status is a local decision, and even when I was asked to close a school, I refused. In addition, working with our governor, my agency worked with nursing homes and other similar facilities to reopen to visitors, even when they did not wish to do so. Another thing I have been falsely accused of is being paid off or employed by Big Pharma. This is ludicrous. As I have testified here before, neither I nor my agency receives any funding from pharmaceutical companies. In addition, we do not work with the World Health Organization. Although we do work with the CDC, as does every state in the nation, the CDC has no control over the recommendations we make at the state level. Some have raised concerns about DEI at DPH. At DPH, all hiring and employment decisions are based on merit and ability and on those factors alone, and have been since I've been director. In fact, the recent independent Legislative Audit Council review of our policies and practices in this area, requested by the legislature, found no evidence of quotas or other inappropriate practices. Now I'd like to talk about the COVID vaccine, which were prioritized by President Donald Trump under his very successful Operation Warp Speed initiative. Despite what some have falsely claimed, I have never supported, and I do not support, mandating the COVID vaccine for anyone. I have recommended people consider getting it, and I have received it myself. However, I have always recommended that individuals should talk with their medical provider about the vaccine or any treatment to make an informed decision that is best for them. Let me also address concerns some have raised about the COVID vaccine for children. I understand and respect those concerns. There is no doubt that the groups of highest risk for bad outcomes from COVID are the elderly and those with underlying medical conditions. It is also true that the vaccine does not protect against COVID as well as everyone had hoped that it would. However, multiple research studies have shown that the vaccine is very effective at reducing the risk of both hospitalization and death from COVID, which is very important. In fact, among South Carolinians, recent data shows that the vaccine reduces the risk of hospitalization by 40%. Although serious side effects are rare, there have been cases of the vaccine causing cardiac side effects, and the risk for these, though still very low, is highest in young adults. At the same time, it's also true that although they are at much lower risk, children and young adults can have severe outcomes and even die from COVID. In addition, children can spread COVID to high-risk adults who live with them. Thus, we do recommend that parents talk to their child's medical provider to discuss whether the vaccine is appropriate for their child. Balancing the risks and benefits is an individual choice that should be based on each child's unique situation. As already noted, I have never supported mandating the COVID vaccine for children or adults, and I never will. I believe individuals have a right to their own opinions and beliefs, and I respect that our views may not always agree. In fact, I welcome and encourage tough questions about our policies and recommendations. However, it troubles me, and I take issue with individuals deliberately and knowingly spreading lies or misinformation for political gain or social media clicks, at the cost of potential harm to others. These falsehoods and lies not only impact me, they are dangerous. They erode the public's trust in our frontline healthcare workers and put the people who believe those lies and falsehoods at risk. To those who have knowingly spread lies and misinformation about me or my agency, I challenge you to take ownership of those actions and make it right. On Facebook, a member of the legislature posted that I, quote, showed a clear disregard for South Carolinian values and freedoms, prioritizing mandates and divisive policies over individual rights, end quote. This statement is completely false. It misleads and misinforms individuals while clearly undermining the governor's nomination of me for this post. As a naval officer, I swore an oath under God to, quote, support and defend the Constitution of the United States against all enemies, foreign and domestic, end quote, and to, quote, bear true faith and allegiance to the same, end quote. This oath includes defending our God-given rights and freedoms. So let me be perfectly clear, so that everyone on this committee and every citizen of this state can hear it directly from me. I have never prioritized any mandates, and I will continue to preserve and defend South Carolinian freedoms and individual rights. I always have, and I always will. Most of you at one point or another over the past 4 years have reached out to me. I have always answered your calls or emails and have never refused to attend meetings requested by members of this body. In fact, I welcome these meetings because I believe that they are the best way to understand each other's perspectives and to resolve any issues. And meeting face-to-face is usually the best way to do that. If you do hear allegations about me or my agency, please contact me, and I will be happy to discuss your concerns about what you have seen or heard. I want to make TPH's public health role crystal clear. We inform, you decide. Let me repeat that. We inform, you decide. DPH has an obligation to South Carolinians to base our recommendations on a thorough and independent analysis of available data, and we do. DPH works to provide accurate, evidence-based information to individuals so they can make informed decisions about their health. We are transparent about how we make those recommendations and what information we relied upon. In the military, after every incident or exercise, we would conduct an after-action report. This is where we would review the entire response and find out what worked well and what we needed to improve. You take what you learn from past events so you can improve future responses. However, learning from the past is extremely different than someone criticizing decisions being made in real time using the best information they had at that time. Indeed, my detractors often overlook that during the COVID response, public officials simply did not have all the information that we do today. No one did. With today's better information and data, there are certainly parts of the COVID response all public officials would do differently. For example, although public health officials relaxed school guidelines faster than the CDC recommended, I would work to keep children in school from the beginning. I would also ensure people in healthcare facilities were able to have physical contact with their loved ones. In addition, I would be more transparent when we made recommendations, both about why we made those recommendations and more clearly acknowledging the limits of our knowledge at that time. When we recommended that schools require children wear masks while in school, we made this recommendation based on the best information at the time. I was very focused on getting children back in school and saw masking as a way to achieve this very important goal. I would also note that we created a waiver form so that parents could opt out of masking for their children if they chose. Although masks are generally not harmful, with the benefit of hindsight, I would have approached this differently and would not have recommended schools require the wearing of masks. Although I hope and pray we never have another pandemic in our lifetimes, if we do, I would apply these lessons learned to any future response. Now, many of you know that my beloved wife of 35 years, Peggy, is at very high risk from COVID due to underlying medical conditions. Her medical team recommended that she and I mask during the height of the COVID pandemic. Contracting COVID could be life-threatening for Peggy. Some have expressed outrage and have even mocked me for wearing a mask. Just look at social media. But whether or not to wear a mask should be a personal choice. There is nothing in this world that is more important to me than my wife and her well-being. I made the personal choice to wear the mask to protect her. Did I wear a mask longer than most people? Absolutely. And I am not ashamed, nor am I going to apologize for trying to protect my wife. Let me ask each of you, is there anything in this world you wouldn't do to keep your wife or husband safe, your children, your parents? I believe you are just like me and would do whatever it takes to protect a member of your family. Thankfully, with COVID rates now very low, I no longer believe I need the mask to protect her, though I do still test if I have any possible symptoms. But believe me, I will wear a mask again without hesitation if that's what it takes to protect Peggy. Now, speaking of Peggy, you may notice she's not with me here today, which is unusual, and I wish she was. Unfortunately, I have been threatened. our car has been vandalized in apparent attempts to intimidate me. Peggy's absence is not a show of non-support, but rather a decision to shield and protect her from a potentially hostile encounter with opponents and those who wish us harm, largely based on the information and false allegations I have mentioned. I already had a very negative encounter with someone in the hallway, as much as I tried to get away. So that is a real risk. She is watching online, and I am grateful for her unending love and support. Governor McMaster, in his remarks on January 20th this year, noted that, quote, "This is the very reason that people do not want to go into public office. Because they are erroneously attacked for ulterior motives, it is dangerous. It is dangerous for the state," end quote. I could not agree more. But let me be also very clear. I am not intimidated, and I am not scared. No threats, no lies on social media, no smear campaign from cowards, many of whom hide behind anonymous letters and false social media identities, will ever deter me from continuing to serve the people of South Carolina to the very best of my ability. However, as important as correcting misinformation, falsehoods, and outright lies is, I think it's equally important to review what DPH has accomplished over the past 4 years under my leadership, and what I plan for us to accomplish moving forward. After all, reviewing past performance and using the gift of hindsight to make necessary corrections is what great leaders do to propel their organization to even greater success. DPH's ultimate success is measured by its vision, a South Carolina which has healthy people living in healthy communities. And in the past 4 years, we have seen the overall health of South Carolinians improve. We have moved on from the COVID pandemic to where it is manageable, much like the flu. Currently, we are closely tracking bird flu, or avian influenza, which is transmitted from animals to people. We are working hand in hand with the state veterinarian and the State Department of Agriculture to provide information and resources to poultry and cattle farmers and their employees, and to monitor for cases in animals, and we have worked diligently to reassure the general public that the risk to them is low. Thankfully, we have not had any human cases in South Carolina, but our public health lab is ready to test for the virus, and we will respond if a case occurs. From an administrative standpoint, I led with outstanding support from the Department of Administration, successful separation of DHAC into 2 new cabinet agencies, the Department of Environmental Services and the Department of Public Health, both of which were fully ready to serve the public on day 1. We are now in the process of moving DPH staff members from several buildings across Columbia to the new facility the legislature approved for us in Casey. We have already successfully moved the first group of our staff, and will have the rest of our team moved by June of this year. This will bring most of our staff who work in Columbia together, along with 3 other state health agencies, into one great facility. This will increase opportunities for collaboration and communication, and will also help us with recruitment and retention. I am convinced this will lead to better service for the people of South Carolina. I led the successful effort to secure funding for, design, and build a new public health laboratory, replacing a cramped and outdated facility. This construction is on schedule, and when it opens next year, it will be able to serve the people of South Carolina for decades to come. Just one example of the great work done by our lab is that it has performed over 240,000 screenings of newborns for genetic diseases that can be devastating, but can often be treated successfully with early detection. Thus far, we have detected such illnesses in over 1,000 newborns, helping save them from severe disability or death. We continue to expand the genetic diseases we screen for as more tests become available. In 2023, we successfully implemented an electronic health record at all of our health departments, improving efficiency, ensuring our patients' information is instantly available no matter which health department they go to, and making their information available to them anytime, day or night, through a secure online portal. Similarly, we have made immunization records available securely online to individuals and parents so they can easily access this information when and where they need it. DPH has a wealth of data on health-related issues in our state, and we are making this much more accessible by sharing it with local communities and creating several easy-to-understand dashboards on our website. It is our hope that individuals and local groups will use this information to identify needs and improve the health of their communities. One great example of this is the first ever Childhood Cancer in South Carolina report, which DPH released in collaboration with the South Carolina Children's Hospital Collaborative. Using data from the statewide cancer registry that DPH maintains, this report shows the gains we have made while also making recommendations to ensure we continue making progress against this dreaded disease. Last year, we also released the State Health Assessment, which utilized this data. In May, we will deploy 3 new mobile health units across the state. These are essentially health departments on wheels, taking our services to the public, making it easier for people to access our services when and where they need them. We have also opened a joint facility with the Federally Qualified Health Center in Dillon, which should serve as a model for other similar collaborations across our state. Sadly, our state is consistently one of the worst for maternal and infant mortality. One of the major reasons for this is a lack of access to good prenatal care. 15 of our 46 counties have no OBGYNs. 5 more have only one. It may take a woman 50 or 100 miles to get to care. To address this, last year we requested, and the legislature approved, funding for a mobile maternity unit, which when operational will bring quality pre- and postnatal care to underserved areas, which we are convinced will help improve the health and well-being of new moms and their newborns. We also performed almost 4,000 in-home visits last year to new moms and their infants across the state, providing support and addressing unmet needs. In addition, our Safe Sleep and Never Leave a Child in a Hot Car campaigns have reached thousands of new moms and other caregivers with the goal of saving children's lives. In the past 4 years, we have also seen an increased percentage of eligible pregnant women and new mothers apply for the WIC benefit, providing important nutrition that they might not otherwise receive. That helps ensure healthier moms and babies. This program also provides breastfeeding support and has led to a 30% increase in babies being breastfed who are in the program. We also have expanded availability of the benefit at farmers markets for fresh produce, which benefits both families and South Carolina farmers. Our 62 health departments across the state, with at least one in every county, provide a wide range of health services to people who otherwise might not be able to receive them. Working to prevent and manage disease. Last year, our health departments provided health care to over 71,000 different individuals, and over 159,000 individuals received WIC benefits through our health departments. Our agency also partnered with law enforcement and others to work with the legislature to address the scourge of xylazine, a drug of abuse, often fatal, which is largely coming in from China and across our borders, making it a controlled substance while still ensuring veterinarians have access to this vital drug. We provide life-saving naloxone, or Narcan, which reverses the effects of an opioid overdose at no charge to schools and law enforcement agencies across the state where it has been used many times. We also make it available in our health departments as part of free opioid overdose safety kits, which include not just naloxone, but fentanyl and xylazine test strips, easy-to-read instructions, and information about how to spot an opioid overdose with the goal of reducing overdose deaths. DPH also supports military families. Last year, we worked with the military and schools to ensure that military vaccination records are accepted for school attendance. DPH is also very active in disaster response. During Hurricane Helene, we opened 8 medical needs shelters and also supplied oxygen tanks and IV fluids to individuals and facilities when supplies were disrupted. I would also note that based on lessons learned from Hurricane Helene, we are working with other agencies to make significant improvements to our sheltering plan for future responses. We also lead the state's strategic efforts for health planning and will soon release the latest state health improvement plan, which was developed in collaboration with over 60 stakeholder groups across the state. It will lay out an evidence-based plan to continue improving the health of the people of South Carolina. For example, our healthcare quality division licenses and inspects over 2,800 facilities across the state, working to ensure the people of South Carolina have access to safe, high-quality health care. For example, we recently had to take action against an operator of assisted living facilities who repeatedly had residents living in several dirty, unsafe facilities. We attempted to work with this operator to get them to improve, but were unsuccessful as they were either unwilling or unable to provide their residents a decent facility. With all other options exhausted, we worked as a team with several other state agencies to ensure all of the residents were safely moved to facilities that will provide them the clean, safe environment that they deserve. We continue to work with stakeholders all across the state. This includes everything from partnering with several churches in the Columbia area on a diabetes prevention and early identification program, to our recently announced Embedded Scholars program with Clemson University, which will provide 2 Clemson professors the opportunity to work closely with DPH to improve the programs and services we provide to the people of South Carolina. I take a people-first approach to all that we do, and we work to be responsive to every South Carolinian who contacts us. I have also focused on being responsive to all of you and your constituents, ensuring we respond quickly and effectively to your and their questions and concerns. I and my agency are here to work with you, to listen to your questions and concerns and those of your constituents, and to help educate about medical and public health matters so that together we can improve the health of all South Carolinians. We must work together to ensure that people of South Carolina have the personal freedom to make their own informed decisions for themselves and their families by being as open, honest, and transparent as possible, based on facts and science, not falsehoods and unsubstantiated rumors posted anonymously on social media by people who claim to be experts, but whose only knowledge comes from social media. Ultimately, of course, any evaluation of DPH or my performance should be based on results, and especially the result of whether the health of the people of South Carolina is improving. And the answer to that question is unquestionably yes. A nationwide ranking of states on health outcomes has been released annually since 1990. Unfortunately, South Carolina has always been in the 40s, one of the worst. However, last year we were 39th. This year we are 37th. Now let me emphasize, 37th is not nearly good enough. As I've said, my goal is that South Carolina is the healthiest state in the nation. However, for the first time in over 30 years, we are making progress. In 4 years, we have accomplished a great deal, but there is more to do, and I would like to briefly lay out my plans for the future. There is no doubt that trust in public health has been eroded, and we need to rebuild that trust. I believe that fundamental to rebuilding trust is listening to the people of South Carolina. To that end, DPH has markedly increased our outreach and engagement efforts. We are reaching out to every community and faith-based group, local governments, and other stakeholders across the state. So far, we've identified more than 10,000 that we are reaching out to. But instead of offering programs or telling them what we think they need, as public health has unfortunately too often done in the past, we are listening. We are asking what they see as the challenges in their communities, and how can we help them? Is it a service we provide? And if not, can we connect them to a resource to overcome those challenges? We then work with them to find those resources, sometimes provided by DPH, but often by linking them with others in their community who can provide these resources. And I intend to continue to expand this effort as we move forward. We are also very focused on improving the safety and quality of care in our healthcare facilities that the people of South Carolina depend on. I intend to make all facility inspection reports and complaints available online where they are readily accessible to the public. We are also implementing consultation teams which will work with facilities to help them improve, identify best practices that have worked elsewhere, and address challenges before they are discovered during an inspection. I also intend to concentrate on the core functions of public health in South Carolina, things that must be done by DPH. We will focus our resources on these areas, and by doing so, we will be able to prioritize limited resources to where they are needed the most. 2026 will mark the opening of our new state-of-the-art public health and environmental lab and the launch of our mobile maternity unit, which I have mentioned. I look forward to the improvements in service delivery that these new advancements will bring to the people of our great state. Most importantly, we will continue our work to make South Carolina the healthiest state in the nation by improving maternal and infant health, by reducing the impact of chronic disease, and partnering with numerous stakeholder groups across our great state. Because working together, there is nothing we cannot do. Under my leadership over the past 4 years, our outstanding team has made great strides to improve the service we provide to the people of South Carolina, and most importantly, has improved the overall health of South Carolinians. The facts I have laid out show that we are trending in the right direction. A change now, followed by potentially another change at the end of the governor's term, would be very disruptive and would risk losing the progress we are making. There is still much work to do, and I believe the vision I have laid out for moving forward will help us reach our goal of South Carolina being the healthiest state in the nation. And although this hearing and my nomination are, of course, about me, ultimately, they're really about what is best for the people of South Carolina and the incredible team of professionals at DPH. When you consider the actual facts, not the misinformation and lies on social media and elsewhere, you will find that if you want a DPH director who supports medical freedom, opposes COVID-like shutdowns, puts the people first, and dedicates himself to improving the health of every person in every community in South Carolina, I am that director. I am convinced that my continued leadership at this pivotal time is in the best interest of the people of South Carolina we all have the privilege to serve, and I look forward to continuing the progress we have seen. Chairman Verdon, members, I ask for your support, appreciate your attention, and would be happy to answer any questions you may have. Thank you.